Hello and welcome everyone. This is Caleb from TASK. We are here today to talk about the recommendation adoption process, or RAP interviews, which is and Rhonda Barkas is here from TASK as well to help, just to help inform and talk to us a little bit about the process. This is a mode of evaluation that helps demonstrate progress over time by indicating the extent to which a project and or recommendations have been implemented. And as we'll learn, it's different than many of the other ways that you might be familiar with for demonstrating and examining your outcomes. We have Christy.
Hi everyone, thanks for coming. This is Christy. I don't think we have any particular announcements for the next. But we do appreciate all of you, all the work that you guys have been doing on the supplement projects, and all of your dedication to making these projects work.
Absolutely, and just a reminder that data from the hospital, the initial final data from the hospital is due tomorrow, and we've still got a couple states or / hospitals that we're waiting on that data for. If you have any questions, please reach out to Tracy or myself following the webinar, and we'll be sure to make sure we're all on the same page as far as what data we need. So let me just start by asking Rhonda to kick us off, so we can get a little bit of the background of the RAP process, the ways it's been used in the past, and then I'll talk a little bit about what the TASK program has used it for and is currently using it for, and then we'll give a couple of examples of things that we both Rhonda and myself use it for, and then we have some questions for you guys to implement. So this process will be for you guys as flex coordinators will involve a phone interview twice with your hospitals, once at 6 months to find out how things are going, what the progress is, and then once again at the end of the project to find out how things went. So we'll talk about that a little more as things progress, but just kind of keep that in mind as we go here. All right, Rhonda.
Okay, thank you, Caleb. Yeah, so I am really pleased to be here with you guys today to talk a little bit about the RAP process, and thought it would be helpful if I gave you a little bit of the background of how we created it, why we do it the way we do it, how we've used it, and then some of the kind of ins and outs of really making it meaningful. So the RAP process, I started working with the center and another facility actually that had the project at the time. It was about 8 years ago, and originally it was because of the Rural Hospital Performance Improvement Project. Some of you all in the Mississippi Delta states might remember RHPI, which went on for several years. And with RHPI, we were supporting 28 to 30 projects a year that were on-site, pretty intense projects with the consultants and with hospitals across the Mississippi Delta states. And so each of those projects were worth about $20,000 to $30,000. So again, about 30 projects a year, $20,000 to $30,000 each. There was a lot of time and energy and money being put into those projects. And so at that time, Bethany Adams, who is the manager, certainly knew that in order with such a big contract such as that, we knew that we had to really start giving outcomes and sharing outcomes and saying that to the federal office that we were supported from, yes, this is money well spent, yes, this is making a difference. And so I was hired then about 8 years ago to start looking at the outcomes from these projects. I think it's helpful for you to know a little bit about my background. My background is not data. My background is not looking at outcomes. My background is actually a master's level psychotherapist, had been working as a therapist for about 20 years. Also, though, I had worked in hospitals in direct patient care for about 25 years. And then eventually moved into doing more organizational development, leadership development for the hospital. And so because of my background, I think that really kind of influenced the way we decided to look at outcomes for RHPI. So when I was tasked with the idea of creating a process for this, I'm just a really big believer that CEOs of hospitals are not going to want one more survey to fill out with yes, no, this kind of thing, that I felt like, I just really never underestimated the value of just talking to people. And so I knew that in looking at outcomes for this project, and again, these were big projects, I didn't want to just look at the measurable data, because we all know that measurable data only tells a piece of the story. I was a firm believer that we needed to talk to these folks and find out really what was going on and what they had been implementing and what were their successes, and really find a way to look at the whole story so that we could talk about the outcomes from the projects, not just the measurable data, but the story that goes along with that. So we created this process that we call WRAP. And WRAP really consists of two different pieces. Part of it is the measurable data. We know that we need to have some measurable data, but we really try to limit that to 2, 3, or 4 measurable outcomes, not 10 measurable outcomes, but something that's really manageable for the hospitals, and hopefully some data that they're already collecting. So that's one piece of it, is the measurable data, but the other piece is the WRAP interview, and that's most of what we are going to talk about today. So to me, the WRAP process is really about bringing the art and the science of evaluation together, and that's one of the reasons I love this. One of the best compliments I think we've ever received about this is Eric Scorsoni, who's an economist in Michigan. He looks at our outcomes for our projects and looks at our return on community investment. And, he is an economist. He is about numbers. And I remember when he saw what we were doing with WRAP, he just said he never valued before, or he never understood the other one. Yep. Yes, that's it. Okay, so we created WRAP for the RHPI program, and then eventually we started we have the Small Rural Hospital Transition Project, which took RHPI's place, and that's we call that SHIRT for short. So we continued to use WRAP for that. And then I did a project for the state of Kansas on revenue cycle management. We found that we could use this exact same process for that project. Another project I've worked on in this past 2 years, has been the Integrative Behavioral Health Project with the state of Minnesota. We use the same process for this. So one of the nice things about this is as you learn how to do RAP, you are going to be able to utilize this process with only a couple tweaks to probably just about anything that, that you want to use it for. So as I said earlier, we look at the data, absolutely, but then the other piece is the RAP interview. So what you see up here is an example for the Integrative Behavioral Health Project. This is an example of our data sheets, the way we do data sheets, because we look at their outcomes every quarter. I do a RAP call with each hospital every quarter and look at measurable data. And so you can see they have their measurable data. So we're looking at cost of services and how that's changed, or the way it's impacted health outcomes. And so we help them to identify 4 measurable outcomes that they're going to be tracking over the course of a year, and then we look at those changes from quarter to quarter. For the SHIRT project, I do a RAP interview with the hospitals twice in a year. I do it 6 months after their project and then again at 12 months. We only look at our data for that one, the measurable data, at 12 months. So again, that's the thing with this process, and this is one of the reasons I love it. It's very organic, and it's really important to be able to flex it according to the needs of your program. With SHIRT, because the projects are so huge, it wouldn't make sense to do it every quarter. The data is not going to change that quickly, because we're looking sometimes we're looking at HCAHPS data, but then we're also looking at days cash on hand or income for the hospital. So that's not going to be as flexible every quarter. So we're not going to gather data every quarter. But this is an example of the data sheet. But next I really want to talk about the RAP process itself. So Bridget, if you'll pull up the RAP questions. Yeah, okay, thanks. So the RAP questions are, this is kind of a guide that I use to guide the conversation that I have with the hospital. One of the, or a couple of the unintended consequences for this process has been that as we have had these conversations with hospitals, many of them have actually realized, oh my gosh, I didn't realize how much work we have done. And so just having this conversation leads many hospitals to even be more motivated, because it's a nice way to review the work they've done. But the first question I almost always start with is, on a scale of 1 to 5, to what extent have you all progressed on your work plan? Or to what extent have you all implemented the consultant recommendations? Again, this is one example of where you could tweak the wording depending on the type of project. So they have what 1 means, 2, 3, 4, 5. Because what I want to do at the very beginning of the conversation is to get a sense of how far are they into the project. So if they say a 2, that gives me a little bit of a framework so that I know kind of what to expect from the rest of the questions. If they say a 5, that's going to give me another thought, and it's going to give me a different thought depending if it's 1 month into it or is it 11 months into it. So anyway, all of it is just information that's going to help couch the rest of the conversation. So I have them give me a score. I tell them, yeah, this is not supposed to be totally objective. It's just their sense of where they are in the project. So I don't need them to start counting how many tasks they've done. Is nothing like that. And I tell them, if you want to give a half number, that's fine. You can say 2.5. So it's just very free-flowing in that way. The next question, though, is the way I always ask this next question is, tell me what's been going well. And, I know in advance what their work plan is, their action plan, whatever, so I have a sense of what kinds of things they're supposed to be working on. But I'll just ask them, what's been going well? And this is where they just talk, and they start telling me, oh, we implemented bedside reports, and we are finding this and this and this and this are happening. And we've also started we've started publicly or putting our HCAP scores up in our hallways in the units, and so now the patients are able to see those, and we're talking about them at the staff meetings, and we've done some training with staff on patient experience. So I get them just to keep telling me everything they have done to implement whatever it is and what they, and I don't care how little it is. I want all the details, or as much as they can give me. And so they'll give me usually a couple things, and then I'll say, okay, and what else? And then they'll sit and think, oh, and then they'll think of something else, and then I'll say, what else? So my response after they share anything in question 2 is always, oh, great, okay, and what else? Until they absolutely cannot think of anything else. And let me go through these questions, and I'll come back and talk a little bit more about finessing some of this. So after we have talked as much as we can about what's been going well, then I'm going to ask them, so what are your next steps? What are your plans? What's the next thing you're going to tackle? And this is where they just let me know, next we're going to have to be looking at the way we do self-pay during collections, okay? So anyway, so just to get a sense of what they're going to work on next. And then the next question is, aside from the measurable outcomes, what are some ways this project is impacting your hospital, its culture, or the community? Now this question, I always explain this to them. This is really important because this gets at sustainability, because we all know that we can support a project in a hospital or a community. They can have some really good data, but unless they have changed something in their culture or the way they work or the way they interact, it's not going to be sustained. The minute we stop looking, they're going to stop doing it, and then the data goes back to where it was. So I will even give them some examples of what I'm talking about here if they're not sure what I mean. So this is where people often talk about things like, oh my gosh, there's so much more accountability with the frontline staff than there ever was before. Or, boy, the leadership teams are working together more with each other. The managers are talking. The communication in the hospital is so much better. Patients are, we're getting such a much better reputation in the community. So this is where, again, not measurable, but just culture change that is going to impact sustainability. And then the last thing there is any measurable outcomes if I need to review that. So what I normally do is when I am setting up a RAP interview, I will contact somebody well in advance. We schedule it on the calendar, and then I will send them the RAP questions, and I send them, if we're doing measurable data, I'll send them that data sheet also. I always ask them to go ahead and send the data sheet back to me prior to this call, because really in the call, I want to be talking about these other things. I don't want to be talking about the data unless I have a question about something in particular, and then if I have the data already, I can say, hey, explain to me why you think those the ED visits from those your depressed patients went down. What were you guys doing? So I can refer back to the data if I need to, but that's not the point of the conversation. Because really what I want is to know what they've been doing and what they feel proud about and what they're successful about. So sometimes we talk about number 5, sometimes we don't, just depending on it. And then I always close by asking, is there anything else that you want to make sure I capture in this? So it's very simple, basically 4 questions that really take some time to go through. The key, however, is that it's really important that this not just be a task, but it's got to be a conversation. And so I will say that I think to make this successful, it's not just going through these questions and checking them off. Okay, I asked this one, I asked this one, I asked this one. It really takes a lot of intuitive talking to the person, asking them questions, sometimes digging down a little bit deeper on things, and paying attention to what's being said or not being said. So for instance, one of the things that I have found a couple times is when I get to question number 2, let's say the project was we were implementing something around revenue cycle management, for instance. And I'm interviewing the leadership team or the CEO, whoever they decide to have in that call. And I ask, so tell me what's been going well. And they're like, well, yeah, we've been doing much better on our upfront collections. We've put some processes into place. So one of the things that I listen to is whether they can talk about specifics or generalities. And so, for instance, if somebody says, oh, yeah, we've been doing better with upfront collections, then I usually will stop them and say, great, tell me more specifically, what have you guys been doing? What I find is, sometimes I get this intuition that somebody, maybe they haven't really done very much work, but they're saying what they think I want to hear. And so I'll ask them the specifics, tell me more about that. And I will say that as I push people in a very gentle, interested way, I think, to find out the specifics, more than once I've had somebody say, you know what, I have to admit, we haven't done a whole lot on this. And then once I know that, then I can say, oh, okay, so what's been getting in the way? And then we can talk about that. And then a lot of times, more than once, people have said, oh, well, you know what we need to do next is we need to get our group back together and get back on track with this. So it's really kind of, again, this idea of the art of the conversation, listening to what's being said, what's not being said, asking for some specifics, and it's really kind of a back and forth kind of conversation, if that makes any sense. And we can get into that a little bit more. Kayla, so that's kind of the overview. And again, this is the one we used with the Integrated Behavioral Health Project, but the questions can be very similar regardless of the kind of project. Caleb, do you have any thoughts or questions of where maybe I need to fill it in a little bit more here?
So you gave a really good example of what happens when, I might not be the most verbose in my answers and giving specifics when I do answer a question. What do you do when I'm kind of just vague and not really interested in in quotes, interested in participating? When I say, oh, on a scale of 1 to 5, it's probably a 3. What's going well is, oh, well, we're moving along with progressing this stuff. I want to hear specifics on how you deal with that, and then I want to hear about how you take your notes, because I know you do it differently than I do. A few of the people who are on this webinar participated in one of these wrap calls with me, and Bridget Hart, who I'm so glad I'm able to have her help participate and take notes, helps me do that so I can, as you were talking about, really have that conversation with someone, so I'm not having to type in the background and try and pay attention. So I'm really interested in how specifically your process is for taking notes, but I think first, I want to know how you deal with, in quotes again, not evasive participants in this, but
sometimes it is. Sometimes it is.
Yeah.
Yeah. Sometimes I know that folks are, they're doing this because they know they have to, because that was part of the agreement for being supported for this project. And I can usually tell pretty quickly, again, if they buy the generalities. And so, I just start asking specific questions. And so, for instance, the other day I was on a call, and the CEO was going off on some other tangents that had nothing to do so much with this project, and I kind of thought, oh, I think he's trying to avoid really talking about the project. And so I just started talking about some of the things, the action items. I said, I know that you guys were going to start looking at bedside report. Tell me what you've been doing with that. And so I started redirecting him back. And And when someone goes off on tangents, I might stop them as quickly as I can to kind of say, oh, that sounds good, but I really want to come back and talk about this because I really want you to have time to talk about what's going well. So I will stop them and bring it back to very specifics. And when I've done that a few times, either I do start getting the information that I need, or that's when somebody has said, you know what, I have to admit we haven't done a lot on this. And again, I'd rather they be honest about that. That's, at least then I know what we're dealing with, and I can work with that because then I know the next thing is just to talk about, okay, what do you need to do to get back on track? I will say also that when I start the conversation with folks, I always let them know that for us, our projects take usually a year to 2 years to fully implement. So I always let them know that up front before I even ask them to rate their 1, 2, through 5, so that people start the conversation knowing that I'm not expecting a 5. In fact, if it's 2 months down the road and they're saying a 5, I'm a little worried about the quality of the implementation because I know that's not realistic for those kinds of projects.
Right,
also,
for the project.
Yeah, and so also the other thing I will say, so it's important to go pretty much in this order, although there are times, again, this process can be organic, and so sometimes I have asked that first question about your RAP score, and they'll go, well, I don't know, and then they'll just start talking about what they haven't done. Then at that point, I might even just kind of stop and I'll say, well, tell me a little bit about what you have done. And then after we do the RAP conversation, then I'll come back to that first question and say, okay, now that we've talked about it, where do you see your RAP score? And then they're like, oh, it's a 3. So again, that's why it's important to be able to use your intuition with this process and not stay tied to a recipe. So anyway, so that's, does that, sorry.
Yeah, absolutely. I think that does. And as you mentioned, and when Rhonda and I were prepping for this webinar, we were talking on the phone, and we mentioned and talked about the fact that, and you've hit this point a couple times, that this is a conversation. This is these are 4 or 5 questions that would take about 15.5 seconds to answer if you just sent it in an email or sent it in a SurveyMonkey. So, I schedule my calls for a half an hour, and they usually take about that long, maybe 5 or 10 minutes over, 5 or 10 minutes under. But there's a reason we want to have a conversation for this. And you get different information than if I sent these 4 or 5 questions to you via SurveyMonkey. And I think the second question about what's going well is so different from most of the questions that you get when you're checking in on a project. Most of the time you ask what's not going well, where do you need help, what roadblocks have you encountered, and I think it really changes the dynamic and is very helpful for the conversation, asking the second question about what's going well. And you talked about it a little bit when you rated your score, but what else is going well? Have you, and I sometimes I'll give a couple mock examples, or, have you been able to connect with your EMS entity or your public health office, or are you having more conversations with different departments than you normally would? Things like that. What's different? What's going well that isn't necessarily in your work plan? Because, like Rhonda said, we have data. I know how many, especially, for the supplemental effort, we can look at the numbers and see how many physicians have been trained in the, opioid reversal drug. That's not really what we're getting at for this measure. We have those measures, and Sarah and Christy from ORHP and Mike will be very, very happy that when we have those things, and we have that data table for that. But this is a very different, a different aspect of it. So how,
that's
another, go ahead.
Oh, I was just going to but you know, that's a really good point, Caleb, because also this is the kind of information that this is what we share then with other hospitals to be able to say, you know, the hospitals that have these measurable outcomes, this is what they did. It's almost like some of the best practices and what works, what didn't work. So it gives you other information that you can then push out to other folks who might be needing to work on the same issues.
Yeah, I mean, so many times we, and I know I get frustrated by just data metrics when you look at something and you say, well, yeah, I can say that you know, 89% of my hospitals are now submitting MBQuip data, but that doesn't really get to all the effort that went in and all the working together from the collection of QI directors from the hospitals, sharing resources and documentation and building a little cohort, and we have monthly phone calls between the two, and one of them even sent over the data extraction tool because they shared an EHR. Those types of things are the things that we miss when we look at just the 89% of my hospitals are submitting data, which is great, and that is an absolute important data metric. But as we all know, there's something that's being lost or missed in that, and this is an opportunity, or one of the tools, or one of the ways that we have found to capture some of that. So I would love to hear, Rhonda, how you, in your experience, and I know how we do it in TASK, but I want to hear your take on how do you distill some of that information, that narrative that you get, and how does that get presented out? What do you do with that data, in quotes, because it's not numbers data, it's information, it's more in a narrative. And then I really want to know how you take your notes, because I cannot have a conversation and take, you know, meaningful notes. I can take, you know, 4 or 5 words here or there and get something out of it. But I'm still just astounded by your ability to do that.
Well, yeah, so I'll go ahead and answer the note question first, because I think that, again, another great example that what works for one person does not work for another. And so I don't know, there's something for me when I'm taking the notes myself, it allows me, I'm thinking differently about what I'm doing. So, and I let them know I'm going to be taking lots of notes. I'll say, so, you know, if I get a little behind, I might just stop you for a second. So I have this sheet up in front of me, and at the top I have the hospital's name and the date of the call and any information I need like that to document. And then under each question, that's where I just start typing away as far as what they're saying. Also, though, if there's a certain action plan, like with the SHIRT projects, they have 10 action items. I always have that on there just so I can reference it easily. But I just start kind of typing as fast as I can, and I don't worry about my spelling or anything like that, because I can come back and clean it up later. But just so that I can at least get a clear sense of what they're doing and what's going well. And I think, again, it's another example of how just different people work differently, because for me, taking notes helps me to focus more on what they're saying and thinking about in the bigger picture of things. Okay, if they were talking about bedside report, what do I need to still ask them about? So I don't know. It's just a different style, I think.
Yeah.
And I guess some people will choose to even record the call and then go back and transcribe some notes later. But so I usually end up, with, usually question number 2 is the biggest answer or the longest answer, and sometimes it's not even usually a page. So question 3 usually is just a few bullet points. Question 4, I just put a few bullet points under. So it's really question 2 that is the most labor intensive as far as pulling together that information. And then to go to your other question, Caleb, about what we do with this. So with the RAP information for SHRT, so each quarter we submit a quarterly report to our project officer. So I have a document that, just a Word document where I collate in bullet points the highlights from these interviews, and I have it just all the hospitals that I've interviewed that quarter, and it's all on in one document so that our PO can see very easily and quickly who I've had RAP calls with, what is their RAP score, what were just the bullet points of the things that they're doing well, the bullet points of their next steps. So it's a little more concise than my working notes would be. And then from that, we put out a newsletter every month called Timely Transitions, and in the Timely Transitions newsletter, we spotlight hospitals and their success. And so I take this information then and I write an article, and then the CEO is able to edit it and read it and change, if there's something they're not comfortable with me sharing, or that they wouldn't want shared more publicly than just with me, then they have the right to edit that, and so that it's something they're comfortable with. So we share those every as we do those. So those are in the newsletter. When we have our quarterly state partner calls, sometimes I'll be on the agenda to share findings from the RAPs. So those are some of the ways off the top of my head that we've used it.
Awesome. One of the differences is I always have a question about, what additional resources or technical assistance can I provide for this project or anything else. So we here at TASC, being the Technical Assistance and Resource Center, I always want to make sure to circle back and ask about, hey, what resources do you need to work toward full implementation, or anything else too, while I have you on the phone. And I've always found it's a great relationship builder. It's a great opportunity just for me at TASC to touch base with the flex coordinators and say, hey, I don't get to talk to all 45 flex coordinators very often, so how's it going? What's going on? What are you doing? Just touch base a little bit and have that conversation. So that really does seem to help in that. So it I don't know. I'm a big fan of the RAP process and the RAP interviews. What questions do you guys have? *2 will unmute your line, or you're welcome to chat some questions in, and I'll have Bridget pull up the questions that we've created here at TASC and with the assistance of ORHP as a starting point for you guys for the effort for the hospitals.
Hey, Caleb, can I say one more thing?
Absolutely. More.
And then I wasn't even going to wait for you to say yes, was I? I was just moving on. So yeah, that's the other thing is that sometimes we've added a question or two depending on the kind of project it is. So for instance, with SHRT, we ask that same thing as far as are there additional resources that you need, or what are the additional resources you need. The other question we always ask, because the SHRT project is about helping people or hospitals to transition into the healthcare of the future as far as payment models. One of the questions I always ask is, how has this project helped you to transition to the payment models of the future? So, because we do want to capture that, because that's another way to show that the project's doing what it's supposed to do. One thing I do, every now and then, I will get somebody who will say, hey, Rhonda, since you're doing these RAPs, can you just ask this question, and oh, since you're doing reps, can you also ask that question? I am really picky about what I'll ask on the reps because I don't. Sometimes we think, oh, we have them, we have them, so we're just going to start asking all these questions. And if it doesn't have to do with this project and their progress on this project, I'll always say to folks, you know what, no, we need to do that in a separate kind of email interview. And the other thing I won't add, or I haven't added to this, is a question where it's just a yes or no, because to me, I can just shoot them an email and say, tell me yes or no. I only keep it to the questions that I really want us to have a conversation around. So anyway, just wanted to add that.
Yeah, I think that, and that is a good point. You don't really want to muddy the waters. Like, this is talking about a very specific thing. So it's good to kind of stay focused and keep on track with that. And as we talked about in the beginning of this, there will be a 6-month wrap interview with each of your participating hospitals, and then at the end of the project as well. So the questions are on the screen here, and as you'll see, or probably have already, they are eerily similar to the ones that Rhonda shared. They are I think they're not verbatim, but they're the same thing. So what is going well? What's with the current status? What's going well? What are your expected next steps aside from measurable outcomes? What other benefits have you seen? So we really want to hear about those other things. Physicians talking to EMS agencies and entities or other facilities. Those are all things that won't necessarily get picked up by just the data report. So what questions do we have? And the additional thing that I forgot to mention, so in addition to this webinar, you have the opportunity, so the wrap question, or the wrap interviews with the hospitals, the 6-month and the one following the project, are required aspects of the supplemental funding effort or project. You do have the opportunity to participate, or we have the opportunity to have up to 2 or 3 calls with me, so coaching calls. So we can do a mock interview if you'd like before your first call. We can do a debrief after your next call, and then prior to the follow-up call. So we just to make it, we take this seriously. It's a really important aspect of the effort, and we want to make sure we support your efforts in this. Like I said, I'm a huge fan of it. I think it's really helpful and beneficial, and we want to make sure we're answering any questions you guys have and supporting any assistance you need.
Caleb, and I will add, since, when we first started with the RHPI, we were only doing the wrap one time, and it was at 12 months, and now with all of our projects, I think we're doing it twice at least. But one of the things that I do is before that next wrap, before the second or third or fourth wrap, I have these notes and I have them cleaned up, and I send that to them in advance as far as the discussion from the last time. And I'll tell them, we don't want you to have to run through everything we already talked about 6 months ago, so I send them my notes ahead of time so they can remember what we talked about, so they can just pick up where they left.
I think that's all the information we have. Do we have any questions? hearing none, I think we can end the webinar a little early. Again, it's being recorded. If you have any questions, you can go back to it, or always feel free to send an email to task@ruralcenter.org or to Tracy or myself. And one last call for any questions or comments, Christy or anyone else? And a final reminder that data from the hospitals is due on Friday, which is tomorrow, December 8th.